Hello, all. Good evening. We are back with the interview series, and I'm here with Dr. Nandini Mhetre. She's a holistic fertility expert and she's an Ayurveda doctor. She wears multiple hats. She is also member of Holistic Health Society community, and it's great to have Dr. Nandini here. Dr. Nandini, good evening, welcome, and I want you to start by introducing yourself. Please go ahead.
Hello, friends. I'm Dr. Nandini Mhetre. I'm placed at Pune, Maharashtra, and I have been practicing medicine for the past almost 25 years now. Basically, I am an Ayurvedic doctor who went on to turn myself into a nutritionist with my postgrad and then PhD in the same area. The reason of transition from Ayurveda into nutrition was basically I felt that when we are able to take care of our bodies uh, to the optimal level by giving the right nutrition, then there is very less chance of falling sick. So this was my intent of getting into postgrad and PhD, and now I am serving the people and the community and this great country of ours, and also on the digital platform, the whole world, uh, with holistic fertility as my area of expertise. The reason being, I have been there and done that, and during my practice years as an Ayurvedic doctor, also, I have had quite many patients whom I had given results with my holistic approach. So here I am doing this service to you all.
Fantastic. Thank you, Dr. Nandini, for being here with us and sharing your thoughts, ideas about holistic fertility to our listeners and viewers. Great. So, let me start with the first question. Um, to what extent is infertility a problem to the society in India and abroad? Just give us a feel of what is the enormity of this problem.
Actually, this is something which made me take up this specialty. The reason was I had encountered enough number of patients who were battling this problem and they were clueless. Actually, this is something which has been there for quite some time. Even when I began my practice way back in the early, 2000 and all that. So then also this was there, but the intensity and the gravity of the problem has been increasing with every passing year, which was not so before. Now we have so many couples battling this problem, not only in our country, elsewhere also. The only reason being lot of changes which have been happening at various levels of our bodies, the impact of so many things which we do to our bodies consciously or unconsciously. So this has become a great problem, and I specialize in two areas. Rather, I mean, I have been treating all kinds of patients, but rather right now have positioned myself in this way because this is the area which I have been able to deliver lot many results, and this is the area which is of a very intense nature right now. That is, one is male factor infertility, with male partners struggling with so many issues when it comes to their fertility factors, like the low sperm counts, the issue with their motility of the sperms, the issue with the morphology, and something called DNA fragmentation, and so many other things. This is an area which is becoming more and more common nowadays. And one important thing what I have noticed is, though reproductive health is important for both the partners, what is happening is nearly 50% of this couple who are trying to conceive and who are not having results with natural methods, is nearly half of their cases are due to male factor infertility, which was not so before. Now this problem has been on the increasing trend. And secondly, I also help those couples who want to have successful IUI and IVF techniques. The people who have tried these techniques and have not been able to succeed in that, I prepare them in such a way that they I work on their the quality of their sperms, the quality of their eggs, uh, and the the whole uh, health of the female reproductive system, because that is very important when it comes to the growth of the child, the embryo, the whole 9 months what needs to be done, that preparation of her body and the hormones and the uterus in such a way that the even though if the natural conception doesn't occur in these cases, which is a challenge by itself, sometimes it does occur even with the failed IVF and IUI. Sometimes it there is a chance, there is a scope for natural conception as well. But let us consider the worst scenario wherein they may again need to go through these therapies, but then the success rate is enhanced by at least 50%, because we have worked upon the basic biological rhythms of the body. And as we all know, let me elaborate a bit on this. As we all know, what is a baby born of, or what is the embryo made of? It is basically two cells from both the partners. That is, the male partner has got something called sperm, and the female partner has something called uh, egg, or a oocyte, what we call in medical terms. So when we work upon the health of these two parameters and other adjuvant or the supportive things which are conducive for the fertilization, the things are solved. It is nothing but a union of one cell, the male cell and the female cell. The union has to happen in a conducive environment with the right set of chemicals, enzymes, and temperature and timing. Timing is again very important. So when we are able to educate our, fellow men who are struggling with this challenge, it becomes very easy, because most of the times what I have observed is, I'm not trying to demean anybody. I'm not against any science as such. Every science has got its own, pros and cons, or advantages and disadvantages. I'm not against any science as such. But most of the time, what is happening is, basically, we are not working on these parameters. There is lot of rush. Actually, the patients or the couples are clueless. So it becomes a moral responsibility for the medical practitioners who are working in the same space to gel with each other, and there the whole scenario of holistic things come into picture. Actually, now is the real time wherein the integrative medicine is very important, which perhaps is the need of the hour, and we have been working towards it. I mean, rather than the IVF clinics or the assisted reproductive techniques specialists working in isolation, if we work together as a combination or a team, wherein the role of a holistic fertility expert like me would be to uh, have the basics prepared, the foundation laid out, and then when the patients are led to that journey, it becomes so easy and the success rate is enhanced. So it is a matter of just perceiving the right things and keeping the mind open for all the sciences as such. And these things are happening at some levels, but if we are able to do it in the mass level, I think our society and our community will be served with this kind of knowledge. Because working in isolation is not of any importance, with uh, the challenges being the same. But when we work in unison and coherence and kind of cooperation, I think that is the next level of what we are actually looking for. Nevertheless, nevertheless, at my end, I am trying. The collaborations can also, I'm open for that as well. The collaborations or associations or working as a team. The whole purpose should be, rather than what I am going to make out of it, what monetary gains we have, or all that is going to happen anyways, because that is a byproduct of the services we give to the patients. But more than that, how can we reduce the pain of the patient? How can you make the journey more comfortable and uh, easy for the patient, so that at the end of the day, it is a patient who matters. It is the results we give that matters. It is the humane touch we give, we have, that matters. And it is very disheartening to say that somehow down the line, we as a community of doctors have not been able to do justice to this part of it. So I feel when we explore or introspect the things for ourselves, it is nothing but a matter of, because of the technology being in place, there is nothing wrong in getting with each other and sharing our expertise to the wholesome good of the patients. For example, if there is one doctor who is practicing somewhere in northern part of a country, and if he sees my profile or he sees what work I'm doing with these patients, and if he takes my help to prepare his patients for the further journey of IVF or whatever, what what more I can do? I mean, what a good scenario it would be that I'll be helping somebody to go through this. I mean, I am doing it at my level already. That is not a challenge at all. But when we can think as, this kind of, mass thinking, wherein all uh, medical practitioners can sync with this kind of thought process, I think that is going to be a great revolution kind of thing when it comes to this couple. So this is the intention of me getting into this area of expertise and helping the people to minimize the problems, give them I mean, I have been meeting so many people who even don't know, they are clueless of what exactly needs to be done. So when we can lead them through this process, and wherever there is a scope for natural conception, that is always happening. But otherwise, if they need some other assisted techniques, and the success rate of assisted reproductive techniques is not so enterprising. It's not that way, because it's again, the whole process happens outside the body most of the time when it comes to IVF. And there are so many other factors also which mm, need to be conducive for the couple, and the pain and that, emotional trauma and the amount of resources and the efforts, I mean, the physical mental level of, whatever uh, trauma that happens to the patients, it's a different story altogether. Because I
Absolutely, I
had,
understand.
yeah, I had a friend who is my very good friend. She is a practitioner herself, and she had to go through this journey by herself, because she was not. And I have seen that the repercussions of all this, a lot of hormonal interventions which were done to her, and which led to obesity and so much of health challenges she faced. So it should not be that in order to get that bundle of joy, you are compromising your whole health.
Very
When
true, very true. In fact, yeah, this is very important point that you mentioned, that there are so many factors that impact this, and the person who goes through technological interventions also goes through a lot of mental and emotional and societal challenges. You touched upon one important point which is very dear to me, which is holistic health. So what do you feel is the role of holistic health? What are the components of holistic health that improves the chances of conceiving? And has there been any study that you are privy to which has established this?
Yeah, there are quite many of them. And if we tabulate that into a data, it is a whole scenario altogether. But rather, let me be specific of actually how the role of holistic approach helps here is basically, because I belong to the fraternity of Ayurveda, and then I, having done my postgrad and PhD in nutrition, what I found out was when we try to balance the body rhythms to the normalcy by whatever methods you use. Especially, I am a believer of being natural as possible. Uh, Again, not against any science as such, but then uh, our human body is an organic uh, structure, which is very much in sync with the nature. So, for any disturbance which is happening in the body at a cellular level, uh, due to whatever reason, especially with this male factor infertility, it is more due to the challenges of so many, unwanted impact of toxins, in terms of so much of pollutants in the food, pollutants in the water, air, plastic pollution, and so many things, eventually leading to the uh, problem of this, motility or counts and all that. So when we bring back those rhythms in place, be it the hormones, be it anything, it is nothing but we try to balance the body to normalcy, bring it back to normalcy. So I believe everything in the body happens with the right physiology, and if there is any disturbance in the physiology, the repercussions are seen in that particular system. For example, for this couple, the reproductive system is not working in a normal way. So when we bring back those body rhythms to equilibrium by applying the holistic approaches, just to mention a few, is correction of their dietary pattern, the first and foremost. And just to highlight on this, uh, we as a society, we as a progressive society, we as the 21st century, kind of millennials or whatever we call, we are really forgetting our roots. Just to give a simile on this, why this was not a big challenge back, way back, during century back, or even during, for that matter, our Neolithic age or the old Stone Age people. All these things were very normal. Why? The reason being, they used to follow the normal patterns of the nature. Now that with the modernization, everything has been changed. So much so that we have forgotten to eat normally.
Very true.
So it is a very sorry state of affairs. Uh, Again, I'll have to talk about a little bit of Ayurvedic context again here. The reason being, basically, in Ayurveda, we have one concept called prajnaparadha, means when we do some mistakes which are against our body. This may be deliberate, or this may be without your knowledge. Both the ways. Prajnaparada is going against our own system, doing the practices which are against our own health. This leads to a disease. This has been already declared in Ayurveda. So I would rather call infertility as a disease created by the mankind. Why these things were not happening previously? The reason was we used to follow the normal rhythms. Brahme Murt, what we call the getting up just before the sun rises. Okay, let us not go to that extent now. At least let us get up before the sun rises. It's around 6 o'clock. Are we doing this? Are we doing this? Let us question this. I mean, we have been, sorry to hurt anybody who's watching this, sorry to hurt your emotions, but I'll just be very, very raw in this. We have the liberty to do whatever we want at any point of time today, be it eating, be it sleeping, be it any of our daily course. uh, like for the eating habits, I would like to, I always take this example with the 24 into 7 malls coming up everywhere, the availability of food with the affluence which has come, with the availability of food at any point of time. Even if you finish one movie at the late night show, and at 11 or 12 o'clock in the night, if you go to a cafeteria, you'll get something to eat today.
True.
The generation now have, I don't know, because of lack of awareness or whatever, they just can't think much beyond this. Just grab something, whether it is healthy or otherwise, you don't know. When it is cooked, we don't know. What they have used in that, we don't know. Just for the sake of eating, I mean, how much ever money they charge, we pay and we eat, not knowing that what we are putting into our body. So first of all, the dietary practices we have been juggling around with, if that is corrected, many things will be taken care of. Second,
Hmm.
secondly, the sleep patterns. I had that opportunity of seeing your live recently, which you have very beautifully crafted. Why, what is the importance of sleep, which I am also very passionate about. because sleep is a time when every damage which has happened to your body the whole day gets corrected at the DNA level. When I spoke about the dietary habits, I forgot to tell about the timing of food also. That is also very important. Nowadays, there is awareness, but how many of us are following really? That is, eat at least 3 hours before you go to bed. At least 2 hours, 2.5 hours before we go to bed. Or the best thing would be just before the sunset. That is the best thing. Or else at least by 7, 7:30, if you're hitting the bed by 10:30 or 11. Give that window of time for the body to digest it, assimilate it, and not to tax your body during the sleep. So these disturbances cause disturbance in the sleep as well. So one is bring back your dietary habits to normalcy, the sleep patterns, and most important of all, especially I would call myself a proud Indian who is very, very, choosy about the discipline, that is the exercise pattern. How many of we, I mean, keep aside you and me because we are into all this space, maybe we are a little bit serious, but how many of our youngsters, how many of our trying to conceive couples, how many of our other area, I mean age groups of people, how many of us are really doing this exercise or any physical activity as a daily activity with no compromise at all? Is that discipline there in us today? Why is exercise important? I don't have any words to express. This is just like you, I mean, we are very lenient when it comes to ourselves, right? We are very lenient. We can't afford to miss one meal. We can't afford to miss one cup of tea at that particular time. But when it comes to exercise, we have all the good excuse that we are time tied or some other challenge. The day you are able to make this decision that exercise is as equal as to your food, as equal to as your sleep, then that is the day we can battle so many of our chronic problems today what we are facing, including this sleep.
Absolutely. Absolutely. I think food, then sleep and exercise, very important
Back to
aspects.
basics, back to basics.
Yes, yes,
This
yes, yes.
I'll just quickly I can recap one incident when I was an intern. I used to, as you know, that I have done my medical education in Hubli. I had an opportunity to work with one very stalwart of his time. The surgeon, the first surgeon of Hubli, Dr. R.B. Patil, with whom I was an intern for quite few months, and it was a privilege to work under his guidance. Whenever a patient used to walk into his cabin, and I used to be there with him to examine the patient and write down all the history and prescriptions, and I mean I was in learning phase that time. This is, I think, in 1998, if I'm not wrong. uh, Whenever a patient used to come inside, and he was such a good doctor, and he used to diagnose the things in such a perfect way. Even with the walking style of the patient, he would understand that person must be having this problem. He was so good at it because of the experience he had, 50 plus years of practice. So whenever the patient used to complain of these two things, ki, I don't feel hungry, or I'm not able to sleep properly, or anything to do with the constipation or passing of the motion anytime, any like, they would seek some solutions like any medicine for that. He used to just scold the patient, telling that these are the things which are basic, these don't need any medicine. Don't ask me for all this. If you need medicines for all this, then you don't come to me. These have to happen normally.
It's that's how a doctor has to start diagnosing. I think I'll convey this to Dr. B.R. Patil, R.B. Patil's son. So he's a
I
friend
know
of
him.
mine,
He's an
and I'll
oncologist. Yeah, he's an
yeah.
oncologist.
So I'll
I had
ask him
work. I
to.
had an opportunity to work with him as well during that period. I'm not
Fantastic,
sure he remembers me, but still. But then they were great, both of them, father son duo,
great,
doing
great,
great service to the
fantastic,
society, and I could learn some of my basics with them during my internship. So
fantastic.
I remember that, and to my dismay, I still have lot many patients, and even some of my kith and kin, and so many people struggling with these basics.
So I
Sorry to say.
understand. So it's a very sorry state these days of how young couple are having a challenge in conceiving. And today you've been able to consolidate it very well as to what is the challenge our society is facing. And then you talked about basics that we need to go back to our diet, sleep, and exercise, and look at fixing those before you look at doing taking any technological help. So it was great talking to you, Dr. Nandini. I would want to have another episode with you. Let me ask my viewers, please let me know if there is any question that you have in your mind. And I would definitely love to get back, bring back Dr. Nandini back to the interview. And we will have a lot of golden nuggets coming from her. Even just
To, s-
implementing those would be fantastic.
to sum up the whole thing, like if any of the trying to conceive couple have the opportunity of viewing this interview podcast, having done the basics, and after still if you're not able to get some solutions, you can always seek some help from people like us. I would be very glad to help you all, uh, be it any problem with these areas, that is when it comes to conception, that I am a person who believes in genuine work. I will only entertain or help those people whom I am confident to work with. That problem should be solvable by me. So the holistic approach I am using is, just to sum up in a couple of minutes, this change, I mean, correction of the diet is the first thing, lifestyle changes, if at all there is anything which needs to be corrected, thinking patterns, the emotional health is very, very important, because the whole, the whole circus of those hormones which is happening in our body is due to emotional health. And the last of all is, I make my patients undergo the strict regime of yoga and exercises to get those results, because without that it is not achievable. So it is a kind of a personalized approach I believe in. And whenever somebody is consulting for that, it is like a win-win situation, because it is a commitment from both the ends. As much as those the as much as you couple are interested in getting a child for yourself, that is the same level of commitment or interest I have in giving you what you really need. So that is the approach I usually adopt, and that is the reason I wanted to, I mean, give this piece of advice before we can wrap up this conversation.
Fantastic, Dr. Nandini. If somebody has to reach you, then what is your email address so that they can reach to you?
Uh, should I spell it out, or can you post
Yeah,
it
you
on
spell it
your
out. You spell
D
it out. I'll type.
D R
Hmm.
N
N
D I N I
N
D,
D I N I
yes, at the rate of gmail.com.
at the rate of gmail.com. Okay. Thank you, Dr. Nandini. I'm just flashing the email address. Please let me know if this is correct.
Perfect,
DRNDINI
perfect,
at the
perfect.
rate gmail.com. So thank you so much for sharing your expertise here. Dr. Nandini is part of Holistic Health Society. We keep on increasing the number of holistic healths who would want to take up holistic way of helping their patients get healthy better. So leave your comments, what you thought about today's session, and what questions do you have in mind for Dr. Nandini's next interview. So
Thank
with
you.
those few words, so we'll take a leave today. Bye bye, everyone.
Thank you.